Classification of the joint. The joints, or articulation, Latin name is articulation, can be classified into three broad types according to the tissues that bind them. First of all, it is fibrous joint, where the fibrous tissue connects the two bones, for example, the anterior longitudinal ligament of the spine. Second type, it is cartilaginous joint, is costal cartilage, example, and synovial joint, example is elbow joint, etc. Also, the joints can be classified by the function. We can classify the possibility to move. Some parts of our body don't need to provide movements, such as some parts of the skull, which fuse it in unmovable joints, the synarthrosis. Second type, it is amphiarthrosis, which allowed small amount or little amount of movement, such as pubic symphysis, which can provide movement only in specific conditions such as pregnancy and delivery of the child. Diarthrosis, freely moving type of connection between the two or more bones, which has some features. First type of joints is synarthrosis. There is unmovable type of joint, can be classified by types of tissues which connect these two bones. For example, the synarthrosis classified in three ways: syndesmosis, by some fibrous tissues such as anterior longitudinal ligament, intertransverse ligament, synchondrosis such as intervertebral disc, and last one is synostosis, which literally means fusion of bones. For example, is the sacrum. The subdivision as syndesmosis can be classified by the feature of these connective tissues between the two bones. The main of them is present on the skull. First of all, it is sutures between the neurocranium, between the facial bones, which connect the bones in three main types. For example, the serrate suture with the tooth-like shaped projections, squamous, when the one bone covered by second, and plane suture between the facial bone, between the maxilla and zygomatic bones, for example. Ligaments such as yellow ligament, intertransverse ligament, membranes present on the bodies, as example of syndesmosis. It looks like a ligament, but it's more wide and fill all space between the two bones. Also form the one-off walls of canals, provide the separation for the different divisions of the bone, and can serve as place of attachment of muscles. It is interosseous membranes, obturator membranes. One type of connection present between the tooth socket, which calls gomphosis, means small ligaments between the root of the tooth and socket will be found there. Last one type of synarthrosis present in newborn between the flat bones of the skull. It calls fontanelles. For example, anterior fontanelle, posterior or occipital. Next type of connection is synchondrosis. Synchondrosis is type of synarthrosis or unmovable joints which present between the two bones, and the tissues which provide this connection is cartilage. It can be hyaline or fibrous. Mostly it is fibrous cartilage. It can be classified in two types, temporary and permanent. Example of temporary synchondrosis is separate parts of sacral bone, parts of the pelvic bones, or different parts of the occipital bone or vertebrae which fuse in one bones during the growth of the. Second type of synchondrosis is permanent synchondrosis, which can be found between the ribs and sternum, costal cartilage, between the parts of the sternum, between the sphenoidal and temporal bone, etc. Means during life this type of connection does not change to the bone, not become to the bone. Next type of connection between bones with presence of slight movement is symphysis. Symphysis or symphysis are secondary cartilaginous joint composite of fibrocartilages, and differences between symphysis and synchondrosis is presence or absence of cavity. If the synchondrosis has gap inside, it becomes symphysis. That's why we have so many options between the two type of joints, such as synchondrosis and symphysis. For example, in some cases between the bones such as sternum and parts of sternum will be as synchondrosis. If this type receives some gap, it becomes symphysis. Also, symphysis present in period of development of body, such as mandibular symphysis between the two parts of the mandible in the newborn. Also, symphysis present like options between the parts of the sternum, in some cases between some intervertebral discs, especially in lower divisions, and main permanent symphysis in our body, it is symphysis pubica between the two pubic bones in the midline, which provide slight movements during pregnancy. Diarthrosis. Diarthrosis is freely mobile part of joints, type of joints between bones, which has 5 main characteristics. All synovial joints characterized as diarthrosis. The main features of diarthrosis is all the synovial joints has the articular surfaces which covered by articular hyalinic cartilage. All these two covered in one structure by synovial capsule, which has 2 parts, fibrous part, outer and inner part synovial. Function of fibrous is protection and make a structure of the joint, and synovial is responsible for the friction and lubrication and secretion of the synovial fluid. Synovial fluid is the fluid which lubricates the 2 articular surfaces, also feed them, also responsible for the friction and shock absorption of the joint, and this synovial fluid present in synovial cavity. That's why 5 main characteristics: articular surfaces covered by cartilage, enclosed in capsule which forms synovial cavity, filled by synovial fluid. If this joint has all these features, it calls through joint or synovial joint or diarthrosis. If some of this option is not developed as well, it calls symphysis. The difference between the diarthrosis and symphysis, it means lack of capsule in symphysis type of joint. Auxiliary apparatus of the joint. For example, features within the some synovial joints with fibrocartilaginous disc, meniscus or labrum. It is some type of intra-articular cartilage which present inside the joint. If this cartilage divides the joint on 2 halves, it is disc. If it's slightly present on the surface of the joint, it is meniscus, is semilunar. If this cartilage surrounds the surface of articulation, it calls labrum. Second type, it is intracapsular ligament, which can be found in hip joint. Intracapsular tenders. Also, to additional features of surrounding joint, we can find the bursa, can find the fat pads, extracapsular ligaments such as coracohumeral ligament of the humeroglenoidal joint, some tenders which surround the joint such as quadriceps femoris tender near the knee joint, and sesamoid bones. All of these structures help to provide function of the joint. On this visualization, you can find in shoulder joint some bursas which located in this joint. Also can find the labrum which surround the glenoidal cavity, extraarticular ligament such as coracohumeral ligament. According to this feature, all the joints, all diarthrosis can be classified again by the several ways. For example, it can be classified by the number of the axes, uniaxial, biaxial, multiaxial, by shape onto the condyloid, pivot, ball and socket, plane, hinge, etc. By structure, complex or not complex. If this joint contains some axillary apparatus of the joint, such as disc, meniscus, or it has some labrum or has some intra-articular ligament, it calls as complex, or if it not, it is not complex. By number of articular surfaces can be classified into simple or compound. Simple, 2 articular surfaces; compound, more than 2 articular surfaces. And by the peculiarity of movements can be classified as combined joint or not combined joint. Means this joint can or cannot has isolate movement with the or without neighbor